grade 12, it's me, yo teacher. So I was requested to take over 12F2 as registered teacher and to do the orientation program with them. So I decided I'm going to record the orientation program so that learners can have something to refer back to if they need to. So this is a orientation program that I have compiled myself on the COVID-19 spread and contagion, and we will be going through all of the things that you need to know now that you are back at school. So over here I've included a quote from Dr. Jarvis Barbosa, who says that timely evidence-based information is the best vaccine against rumors and misinformation. So we know that the only thing that spreads faster than a virus is misinformation and fake news. So this the aim of this orientation program is just to iron out some of the kinks, answer some of your questions, and just to put you a little bit at ease in terms of how will things be like going forward. So the first thing that you might ask is, what is COVID-19? So coronaviruses are actually very common throughout the world. There are many different coronaviruses identified in animals, but only a small number of these can cause disease in humans. On the 7th of January 2020, severe acute respiratory syndrome, or coronavirus 2, SARS-CoV-2, was confirmed as the causative agent of the coronavirus disease 2019, or COVID-19. The majority of the case patients initially identified were dealers and vendors at a seafood, poultry, and live wildlife market in China. Since then, the virus has spread to more than 100 countries, including South Africa. So just a few things that you might want to have explained. I'm sure you've heard the term severe acute respiratory syndrome, or SARS, before. Do you guys remember bird flu a few years ago? That was also a coronavirus. That's why it's called coronavirus 2. This new one, COVID-19, is a different strain of that bird flu that occurred a couple of years ago. The reason it's called a coronavirus is because the little spikes that come out of it. So if you look at it under a microscope, you'll see that these little spikes come out of it, and the initial scientists who noted that thought it looked like a crown, so they gave it the word corona, which means crown in, I think, Latin or Italian, not sure. Right, so first, what are we going to do in this presentation? We're going to look at how can we prevent coronavirus? What is the numbers and the data about the spread? What can we do for some emotional support? And how can we overcome this pandemic together? So how do you get COVID-19? A person can contract COVID-19 if they come into contact with another person infected with the virus, someone who is infected coughs or sneezes directly onto them, or they touch any surface with little droplets from the infected person's cough or sneeze and then touch their eyes, nose, or mouth. So prevention. What can we do? Here's some advice to help prevent the spread of the virus. So what must I do before I leave home? The first thing you have to do after you are all dressed up and ready to leave the house is wash your hands for at least 20 seconds or use sanitizer. Now, one of the popular ways that's going around, they tell you to sing happy birthday twice. Secondly, you must avoid touching men. In other words, mouth, eyes, and nose. Thirdly, if someone is coughing near you, tell them to far cough. And fourthly, if you are sick, bly by die huis, stay at home. Number 5, cough and or sneeze into your elbow or a tissue and throw used tissues away. It is very important that you throw used tissues into a lined bin that can close. You shouldn't just throw it into the plastic bin, because then you contaminate the plastic, and coronavirus can actually last for a very long time on plastic. So that's why you have to throw it in a bin that has a bin liner or a packet inside. And then lastly, clean and disinfect the objects that you touch frequently. Now, there's a video going around of Julius Malema speaking about how even if we have all these procedures at school, on their way to school, these kids are socializing and they are partying at home and they are seeing each other and they're not practicing social distancing. So by the time they come to school, they already have coronavirus. So what can we take from that? Firstly, we must practice social distancing and good hygiene. So even if we are not at school, we should stay away from large crowds, because we don't know if we are infected and we don't know if others are infected. So rather safe than sorry. If you look at number 2, do not walk in large groups or in close contact with another person. So keep 1.5 meters between you and the next person as you walk to school. I know we're used to walking in large groups, but unfortunately, we need to keep ourselves safe and we need to try and keep our distance from people, just for our own safety. Number 3, make sure your bus or taxi is following COVID regulations. I'll explain what the COVID regulations are in a moment. Okay, so these are the rules for public transport. It has been gazetted, meaning it is legal requirements that your buses and taxis need to follow. So firstly, no person is allowed to use public transport if they are not wearing a face mask. And as you know, under level 3, everybody needs to be wearing a face mask. Second, loading capacity for minibus taxis remains at 70% of passengers, with social distancing and other measures remaining in place. So if you see a taxi and it looks like it's overfull, rather wait for another taxi. You can come late, but rather risk that than getting infected. So 70% full, and stay as far away from people as you possibly can. Then, you need to make sure that the vehicle is regularly sanitized after each use. So the taxi comes out here, it picks you up, it drops you off, and then by the time it makes its next trip, it has been cleaned and it is waiting for you. What must I do when I arrive at school? So line up outside the main gate, provided it is not raining, to have your temperature taken. If it is raining, you can skip straight to, but if it isn't raining, you line up outside the main gate to have your temperature taken. You need to remember your reading, because they use that number for screening a little bit later on. If your temperature at the gate is more than 38, you will be sent to, which is room 19. Your parents will be called and then they'll have to fetch you. Your options at that point is either to phone the coronavirus hotline or just to do another test, just to see if it was maybe the temperature scanner that was the problem. But if we feel that you are you have to proceed to the main hall. You will line up where indicated for screening. So you will be put in your class groups like 12A, 12B, 12C, 12D, 12E, 12F, and then there'll be a teacher or a healthcare professional sitting in the front and then asking you a bunch of questions. The questions are just to determine if you are sick or if you have, or if you are indicative of having coronavirus. So as a result of that, you must answer those questions honestly. If you are lying about one or two, you are putting everyone at risk. Number 3, you need to go directly to the class you are assigned to. So in your case, it will be either room 51 or room 53. Now, some learners will feel like they want to catch up with their friends, they haven't seen them in 2 months. Please do not do that. You are putting yourself at risk. Do not loiter or chat with your friends. Go straight to the class you are assigned to. When you get outside that class, there will be someone standing outside the door to sanitize your hands before you enter the class. And then when you enter the class, you'll see that your name will be pasted on one of the desks. So the way we've set it up is we put a person at a desk, and then the desk behind them is empty, and then the next desk someone sits there, and so on and so forth, to keep that social distancing in place in the classroom. So when you get in the classroom, sanitize your desk, and then clean and disinfect any objects you touch frequently, like notebooks and things like that. If someone in your home is sick, you must continue to practice everyday preventive actions. You must keep the ill person in a separate room from others in the household. If you are caring for a sick household member, please monitor your own health. Keep surfaces disinfected and also avoid sharing personal items. If you become sick, stay in contact with others by phone or email, and take care of the emotional health of your household members, including yourself. So what is social distancing? It's basically keeping a safe distance away from other people. So if they are sick, or if you are sick, nobody can pass the virus to each other. So the recommended distance, according to the COVID guidelines, is 1.5 meters, but about 1 meter in this PowerPoint should be fine. So you need to keep a 1 meter distance between yourself and other people. And please, 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 if possible, try not to come into contact with the elderly, as they are the most vulnerable to the virus. How do you know if you have COVID and it's not a normal flu? And when do you need to go to the hospital? So a lot of people, it depends on your immune system. I feel as a doctor hospital. Your lips or face are suddenly turning bluish. What that means is you are not getting enough blood flow to the brain and to your upper part of your body. Number 2, if there is a persistent pressure in the chest. So if it feels like somebody is pressing down on your chest all the time, that is an indication that you may need to go to the hospital. Thirdly, if you are experiencing confusion or the inability to wake up, that is also a major warning sign. Please get yourself to the hospital. And lastly, if you are having difficulty or trouble when breathing, immediately get yourself to the hospital. So let's just go over that again. What are your protection tips? You have to maintain social distancing, keep objects and surfaces clean, wash your hands frequently, don't touch eyes, nose, or mouth. Clean frequently touch surfaces and objects, and wash your hands. So you need to use a sanitizer that has at least 60% alcohol content if you are not using soap and water. I will show you the demonstration of how to wash with your hands. Basically, you have to wash in between the fingers, palm to palm, your fingernails, your wrists, your thumbs, and then you rub until it's dry, and then you will be disinfected. We must each do our part to make sure that the coronavirus does not spread at the school. So in the next video, I will be speaking about infection data, which is some numbers and data on the spread of COVID-19. So I'll see you in the